the boob job blog, complications. I wanted to talk a little bit today. It's been about just over 2 weeks since my revision, so I wanted to talk a little bit more about what happened. I kind of told you guys that was before my first post-operation appointment about some of the complications we had had. So I wanted to talk about what happened. I was super groggy after surgery, so I didn't really get the chance to talk to my doctor. And then when I went in for my first post-operative appointment, he kind of explained a little bit to me why some of the things happened. So if you are not familiar with some of the risks of getting implants, especially with the, what's the word I'm looking for? It's kind of the deformity that I had before I had any of my procedures. I had what was called tubular or tuberous breasts, and that can run the risk of what's called bottoming out. If you don't know what bottoming out is, it can happen from malposition due to your doctor. It can happen because your breast tissue cannot support the implant. It can happen for a lot of different reasons. If you don't wear your support bra, if you're pushing yourself too much after surgery. But pretty much what it means is if you choose to get your incisions inframammary in your fold, they pretty much should not be visible. And when I had said before that I had kind of assumed that I had started to bottom out, what that meant was my incisions, which were originally supposed to be, you know, in your fold, right underneath your breasts, they were about two inches. So they were about here when they should have been here. And I didn't my doctor and I hadn't really talked about it, and I didn't know that there was something bad because when I looked at them visually, they looked fine. So one of the things that he had to do in surgery was replace the incisions and re-put them in my fold, which I had mentioned about him adding sutures in. So he pretty much had to like tack the skin and reposition it. So my incisions are a lot more, they're larger, there's way more scar tissue built up. But he had kind of explained to me that because of how my breasts had started to bottom out, if I hadn't chose to get them redone now, then they would have needed to be redone anyways. So that kind of makes me feel like I made the right decision because I was unhappy with the size, and that was one of the reasons I wanted to get them redone. But just the fact that there was a problem that needed to be fixed, it made me feel way more comfortable, like 100% I made the right decision. About 9 days after surgery, I started to get like exceptionally itchy. And last surgery, my incisions got itchy, but it was tolerable. When I say that I was itchy, I was like screaming. My incisions felt like they were on fire. They were so itchy. This time, because he had extended my incisions, the steri strips they put over them, he used 2. And they just fall off naturally. I felt like the last time they came off later on after surgery, but this was 9 days. My left steri strip came off, which is just like sticky tape, came off in the shower. And that day, it was a Sunday, my fiance and I were going out, we were shopping, and I was getting so frustrated. I was uncomfortable the whole day. We went home and had dinner, and I was like almost in tears. I was in so much pain from just being uncomfortable. And we contacted his mom, who is an LPN, and asked her what was happening. And I took pictures of my incisions, and I had what she told me, and then I later called my doctor's office to talk to them about was I had started to have an allergic reaction to the adhesive. So that was what's making me so itchy. And I will post a picture of what my incisions looked like because I wanted to take a picture of them so you can see the skin around them was inflamed and red and irritated and so uncomfortable. So they told me to just, and his mom told me to just get in the shower, wash it with antibacterial soap, and then put hydrocortisone cream. So I just went and got like, this is what it looks like, just generic hydrocortisone cream. This is actually my second tube. I went through a full tube. I'm on tube 2. And then to take Benadryl. So I just went to the dollar store and got like an allergy relief Benadryl. This is just an antihistamine to help with the reaction. And for the first couple of days, that helped immensely. And my camera broke, so I'm using a webcam right now. So the camera quality is probably horrible, but if you can't tell, I have a rash in between my breasts, and I will post a picture of that as well. Um, a couple days ago, my irritation, the itchiness hadn't gone away, so I called my doctor, and I started to get this rash in between my breasts. Um, and they told me to wipe it down with alcohol, like rubbing alcohol, wipe down in between my breasts, not my incisions. Get in the shower, wash it with antibacterial soap, and then I have switched the cream to this bacitracin, which just comes in these little packets that Michael's mom gave me because she has it. So it's a first aid antibiotic cream with zinc. It helps with itchiness. That was on Friday that I was starting to get more concerned. It's Sunday now, and I will probably call the doctor again tomorrow because the rash has not gone away. So I don't know. I guess maybe I'm a little worried. If you do not use the website Real Self and you are considering getting cosmetic surgery, you are crazy, because any question I have ever thought of, I can use that website and ask, and it will give me an answer from doctors that other people have asked. It's my favorite website. I'm probably on it every day, looking up questions, people's before and after pictures, what other people are going through. And at first that was the website that I used because I was like, wow, this feels more itchy than the last time. This feels uncomfortable, and lots of people have that problem. And there was one other girl that I found who had posted that her incisions were itchy, that the Benadryl and the hydrocortisone creams helped for the incisions, but now she has a rash in between her breasts. And it makes me feel like, oh, like there's other people out there that are going through the exact same thing. The one doctor response that he said is that it could be a fungal infection. So that makes me kind of nervous. I mean, I take a lot of antibiotics every day because of my acne that I go through. So I don't know. I don't know. I also took a picture of the rash so you can see it kind of more close up. You don't see any nipples or anything, but it's just kind of a lot to deal with. I still don't regret my decision, because even though I have the itchiness and the rashes, I feel like I made the right decision because of the bottoming out. I had the gauze here for an entire week to give me the lateral compression, because when you bottom out, they worry that that the implant could bottom out again, and that can happen if you don't have enough breast tissue and you have a heavy implant. So that helps to make sure that my implants stay positioned, but I don't have to wear the gauze for the lateral compression at all anymore. One thing that my doctor told me when he was looking at them after the first week is I have to wear my support bra 24 hours a day for 3 months. And he was like insanely strict about that, because he wants to make sure that I'm getting the support that I need, so that way my breast can heal completely. And then he told me that after those 3 months, I could possibly switch to a sport bra as long as it was very, very supportive. And I know that there are lots of doctors who have different feelings on support bras. Some people say, yes, absolutely, you have to wear it. And there are some doctors who say they really don't feel like it makes that much of a difference in the healing process. But my doctor feels very strongly that since I have bottomed out once before, I must wear this. When I was on that Real Self website, there is a term they use for bottoming out called, I want to say ptosis, but that's not right. It was like PTOSIS, which just means like sagging of the breast. One thing that I noticed, and visually now that they're fixed, they look so much better than they did before. This incision is completely where it should be, totally in the fold and not visible at all. But this one I've noticed has migrated just a little bit north. I suspect, I have another appointment this Thursday. I suspect that he will tell me, from what I've read online, this is just what I think he'll tell me, that this early on, it could be just a slight bottoming out because they look they look totally fine, and that we will just keep a very close eye on it. If it starts to get worse, then we will act. But I suspect that this far, like this close in from my surgery, he'll say like, it's fine, we're just gonna watch it. It could just be a little bit, and it may not get any worse. My pain levels this time were way better. I've been taking the Benadryl, one in the morning and one at night, and then just taking ibuprofen throughout the day. I was taking 2 ibuprofen every like 3 to 4 hours for pain, and now I'm kind of down to as needed. So I notice when I wake up in the morning, that's when I'm in the most pain. So I take it in the morning, and then throughout the day as I'm, going back to work and getting everything figured out, that it's very tolerable. I still lay on my back, and I was almost wondering if me trying to lay on my side and like really pushing it last time had to do with the mispositioning, however you say it, the poor positioning of my implants, because I am such a side sleeper. But I keep myself propped up on pillows. I force myself to lay on my back, and I'm just trying to tough through it. My back hurts a little bit from sleeping on my back so much, but as always, thank you so much for watching. Please subscribe and let me know what you think of everything. If there's any questions I haven't answered, I would love to answer them. But I really appreciate you taking time out of your day to watch my video, and I would love to know what you think of it. So I hope you have a wonderful rest of your day, and bye!